Hi, I am Azrinaja from 4th year BPT. My topic is contusion and its management. Let's go into the topic. What is contusion? A contusion, it is also called bruise. It occurs when a direct blow or repeated blows crush underlying the muscle fibers and connective tissues and resulting in capillary rupture and bleeding into the surrounding tissues without breaking the skin. This is a contusion. Next, types of contusion. There are several types of contusion that is caused due to the injury of the organs. Muscle contusion, skin contusion, bone contusion, cardiac contusion, lung contusion, brain contusion and spinal cord contusion. Muscle contusion. Bleeding within the muscle fibers due to the blunt trauma that affects the large muscles like quadriceps and biceps. This is the quadriceps muscle contusion and this one is biceps muscle contusion. The common causes are sports injury, direct blow or falls. Symptoms are swelling, tenderness, hematoma, pain with movement. Management. During the acute phase 0 to 72 hours, like within the 3 days, we can give RICE protocol, rest, icing 15 to 20 minutes every 2 hours and compression elevation. Avoid massage, stretching that prevents the myositis ossificans. During the subacute phase 3 to 7 days, we can go for gentle pain-free range of motion exercises and isometric exercise. Rehabilitation phase after 7 days, we can go for progressive resistance training, stretching, balance training, functional or sports rehabilitation, and also we can give ultrasound if hematoma is present with care. Next, it is skin contusion. It is also called bruise. Bleeding under the skin without break that affect the superficial tissues. It is shown in this picture. Common cause is bumping into the objects or falls. Symptoms are blue or purple discoloration of the skin and tenderness. Management, icing 15 to 20 minutes, compression bandage if swelling is present, and elevation of the limbs. Topical agents like heparin and arnica can be applied, and then avoid heat or massage in the early phase. No physiotherapy is required unless the swelling affects the mobility. Then bone contusion. Bone contusion is also called bone bruise. This is shown in this picture, that is injury to the bone surface with marrow edema but no fracture, less severe than the fracture. Common cause is fall, sports, trauma, impact, shin injuries. Symptoms are deep ache, pain on weight bearing, swelling, hard lump. Management is like protected weight bearing, use crutches or walking aid, rest the limb or joint, icing for pain and swelling, and side for pain and inflammation. Gentle range of motion exercise we can give after pain subsides, and gradual return to the activity like 6 to 12 weeks is the healing time. After that period we can go for gradual return to the activity. And this one is showing the x-ray of the bone bruise. Cardiac contusion. Cardiac contusion, it is bruising of the heart muscles from blunt chest trauma. Causes are road traffic accident, fall, chest hit. Then symptoms are chest pain, arrhythmia, hypotension, ECG changes. The management is hospital admission for cardiac monitoring, ECG, echocardiogram for arrhythmias and wall motion, oxygen therapy, treat arrhythmias or hypotension, limit physical activity until cleared, no physiotherapy in acute phase, resume only after cardiology is cleared. Then lung contusion. Lung contusion is also called pulmonary contusion. It is bleeding into the alveoli that cause impaired gas exchange. This is showing an x-ray. That is the common cause is blunt chest trauma or rib fracture. This is showing the rib fracture that is causing lung contusion. Symptoms are chest pain, dyspnea, coughing, tenderness, hemoptysis, and low oxygen. Management for this is monitor oxygen saturation and respiratory rate, oxygen therapy or ventilatory support if severe hypoxia is present, pain management, especially if rib fracture is present. Once stable, chest physiotherapy is given, like breathing exercise, diaphragmatic or segmental breathing exercise, and airway clearance, ACBT or postural drainage technique we can give. And incentive spirometry. Avoid early over aggressive manual techniques. Then brain contusion. It is also called cerebral contusion. Bruising of the brain tissue with edema and capillary leak causes head trauma, fall, coup, counter-coup injury. This is an MRI. It is showing the brain contusion. Symptoms are headache, unconsciousness, seizure, neurodeficit, bleeding, swelling inside and outside of the brain, seizure, slurred speech, trouble walking. Management, acute phase, ICU monitoring for intracranial pressure, maintain oxygenation and fluid balance, anticonvulsant if seizure is present, no head movement or physical therapy in unstable stage. Subacute and rehabilitation phase, we can go for neurophysiotherapy like positioning and mobility training, balance, gait training and functional activity training, cognitive therapy, speech therapy if needed, prevent the complications like pressure sore and contracture. Then spinal cord contusion. It is injury to the spinal cord without complete tear that disrupt the nerve impulse. This picture is showing a spinal cord contusion, and it is caused by road traffic accident, fall or vertebral injury. Symptoms are like paralysis, sensory loss, tingling or numbness, inflammation, swelling, loss of balance, bladder or bowel issues. The management is during the acute phase, immobilization of the spine, high dose steroid, example methylprednisolone within 8 hours is given, and prevent secondary injuries. And rehabilitation phase, we can go for physiotherapy like passive or active range of motion exercise, strengthening exercise of available muscles, and gait training if applicable, wheelchair mobility and transfers. Occupational therapy for ADLs and fine motor skills, bladder and bowel training, and psychosocial support should be given. The reference for muscle, skin and bone contusion, I took the notes from orthopedic physical assessment by Maggie and therapeutic exercise by Kisner and Colby. For brain and spinal cord contusion, I took the notes from the physical rehabilitation 7th edition by O'Sullivan and neurological rehabilitation by Umford, and cardiac and pulmonary contusion from Hoff's cardiopulmonary care. Thank you.